It's my true pleasure to introduce you to Denny Pretz. Denny has been with Pharmanex now over 22 years and has helped literally hundreds of physicians across the country learn about this program and functions as a medical liaison, teaching doctors what the fundamentals of the BioScan program are and just how exactly it can impact not only their patients' health, but the financial health of their bottom line of their practice. So without further ado, welcome Denny Pretz.
Well, thanks, Karen. We had such a great call tonight with just tons of science and great testimonials, and I'm asking you doctors now to take off your science hat for a minute and put on your businessman's hat, because I'd like to go through the numbers of how this program can be of benefit to you and your patients in your practice. First of all, when you scan a patient, it's going to be a 90-second scan that will probably be performed by your nurse, and you're going to earn from every patient that you scan. You're going to be able to build a residual income through the supplements that you recommend to your patients. And then a third benefit was quite unexpected. We find that when a patient gets scanned, they go back into their community and they tell their spouses and their friends and their coworkers about what they saw in their doctor's office, and the doctor is constantly receiving new patient referrals because of the scanner. Now, I want to talk for a minute about return on investment. I know that when you buy equipment or lease equipment for your office, typically the return on the investment is 3 to 5 years. But with this program, the BioScan return on investment, I'm going to show you how it can be 5 to 20 times your investment on an annual basis. Now, we're going to charge each patient an initial copay, if you will, or charge to scan of a minimum of $20. Different parts of the country, they charge different amounts, but for this demonstration here, we're going to talk strictly about $20. And here's how you get your scanner. Your initial investment is going to be a product purchase plus a deposit on the scanner lease plus some shipping. It's going to end up, you're going to spend about $3,500 to get into the program. Now, I know every doctor on here would invest $3,500 in a stock if they knew at the end of the year it was going to be worth $25,000 to $50,000 annually. So let's talk for a second about how we earn money through scanning revenue. You're probably seeing 20 to 40 patients per day, but if we just use some minimum figures here and just scan 2 or 3 patients a day, that would be 50 scans per month, times that $20 figure for the scan. That's $1,000 per month, or $12,000 per year just in scanning fees. Again, that's a minimum figure, but you can see that already just by scanning a minimum amount of patients, we have a 3.5 times a return on investment. And as you heard Dr. Feld speak of scanning about 200 patients per month times $20 is $4,000 a month just in scanning fees. You're also going to earn on supplement revenue. And, again, we're going to talk a really small number of patients participating in the program, but if you just had 50 patients purchasing $100 a month of one of our supplements that will be sent to their home on what we call the automatic delivery rewards program, so the doctor doesn't have to inventory any of these supplements, the 50 patients doing $100 a month would create a sales volume of $5,000 per month. Now, when that happens, that triggers a free scanner lease. You no longer have to make a payment on your scanner lease in any month where you're doing $5,000 in sales volume. In addition, just off those 50 patients, there's a commission that would be earned annually of $13,200, and that's residual year after year, because we have about a 90% retention rate for our patients who get scanned, start taking our supplements, watch the number go up. They literally just stay on our products forever. But if you take that $13,200 that you would earn just from the 50 patients and $12,000 that you would earn just by scanning 2 or 3 patients a day, that's $25,200 in annual income. And now we're at 7.5 times return on investment. And again, we've done the bare minimum of working the program in your practice. Now, how many of your patients will participate? We know that you've got thousands of files, and a minimum of 10% of them will want to increase their antioxidant levels and improve their health. The national average shows us that for every 100 patients that you put on our program of auto delivery of our supplements, it's going to equal about $30,000 a year in residual income plus the scanning fees. So now it's time to ask yourself, do you have an exit strategy? Do you have a retirement date in mind? How are you going to live the lifestyle that you've developed as being a doctor once you retire? And we can show you how to take this residual income into retirement with you. Let's suppose over the next 2 or 3 years that you put 300 patients on our program. That would be a $90,000 a year residual income plus scanning fees, so really over $100,000 a year that you can take into retirement. And if you were to sell the practice, that income stays with you. It doesn't stay with the practice, it stays with you. So let's talk about the rental agreement for the scanner. It's really, it says a lease, but it's really a rental agreement because it's 36 months at $209 a month, but they don't hold you to it. You can get out of this lease at any time you want. If 6 months down the road it wasn't working in your practice, you could simply box up the scanner and send it back and stop making the $209 a month payment. Well, our healthcare practitioners who work this program really never make a lease payment, and here's why. In any month where you add 5 patients to an ADR, an automatic delivery of any of our supplements, 5 patients in a month, they waive that $209 payment. And again, once you have 5,000 or more in sales volume moving through your organization or your practice each month, there's never a lease payment. And that can be accomplished with 40 to 50 patients on the program. And as you'll see, we're going to do way bigger numbers than that in your practice. So let's review the program benefits. First and foremost, we're going to make your patients healthier. I think that's the aim of every doctor on the call. Secondly, you're going to earn a minimum of $12,000 a year by scanning in your office. You're going to build a residual income through the supplements to take into retirement, and really that number can be as big as you want it to be depending on how aggressive you get with scanning the patients and recommending the supplements. You'll have a free scanner lease. It makes your practice high-tech and cutting edge. You're going to receive new patient referrals, and I think you'll have to agree with me, it's an extraordinary return on investment. Now, here's the program will only work and only be successful if the doctor uses the Pharmanex products to increase his or her own antioxidant score, meaning you need to get your baseline as soon as possible. Then start taking our products and watch that score rise yourself because you're going to be recommending these products to your patients. All your patients come to you and respect you and love you, and when they hear you say, this is what I'm taking and this is what you should take, I want you to take it for the next 90 days, and if we don't raise your number, we're going to give you all your money back, and we're going to scan you from now on for free. A very high percentage of your patients are going to participate in the program. Also, it's essential that we compensate the staff for the scanning and doing the follow-up. So generally, you'll get 1 or 2 of your staff up to speed on how to do the scanning. They will do the scanning. They will hand you the chart with the number on it. You'll recommend the products. And when you'll send them back to the staff to place the order and to do a follow-up to get them back in for their 30-day and 60-day follow-up scans. Generally, we'll take $5 of the $20 scan fee and bonus the staff for every scan they perform. So it's been my experience that if you have a staff member that scans 20 people the first week and you hand them $5 per scan or $100 at the end of the week, the next week they'll scan 40 people or more because they love those bonuses and they love participating in the program and helping the patients get healthy. And it's absolutely essential that you charge for the first scan. Sometimes we get very generous doctors who say, "Oh, I'm going to get the scanner, but I want to scan my patients for free." The program will fail if you do not charge for the first scan. And when you get into our training that we're going to provide, we will show you exactly how that works. So we'd love to assist you and train you and your staff on how to implement the BioScan Wellness Program. If you didn't get enough science tonight, my gosh, we've got white papers, clinical trials, and studies on the scanner. They can all be made available to you on request, and there's more science here than you can believe. So we hope you see this like we see this, and we'd love to help you implement this into your practice.